Thank you to all the panel members for those great remarks that are helping to pull together a lot of threads that we've heard over the last couple of days. And those remarks were actually a good segue for something that I wanted, an observation that I had on also on the Sustainable Development Goals. And that is that there is no goal that includes health system strengthening. And I was rather surprised to see that, since that is going to be a pillar of implementing universal health care. So as we move forward out of the Millennium Development Goals towards the Sustainable Development Goals, if they are to provide a roadmap, for the global community, for national governments, for bilateral and multilateral funding agencies, I think it would be important to recognize the role of health system strengthening. Right now, if you look at the goals, there are still quite a few pillars mentioned in there. There's maternal health, there's HIV/AIDS, there's non-communicable diseases, and I feel that might leave us in the same place we are now, even though the global health community is quickly moving towards, primary care and moving away from those pillars. So I found that perhaps those weren't quite as future-looking as the global health community is the direction they're already moving in. So I'd like to hear the comments of some of the panel members regarding the importance or not importance of having health systems mentioned in the Sustainable Development Goals. And I just wanted to also quickly just expand a little bit on what I heard. I think every single panel member measured metrics, and coming from a university, of course, I love that. And I think that, again, there's a great role for universities and partnerships when it comes to metrics. And I would just like to reiterate, and I'm sure that there are some tools available, but it will be important for us to, as a global community, to identify tools that can be shared across boundaries, across programs, so that in the end we do have data and analysis and programs that are actually comparable and that we're learning from each of our projects, so that we don't have to learn lessons over and over again. And I think this is also a place where universities can come in terms of sharing of data, sharing analysis, publishing, pulling a lot of this information kind of out of the gray literature where it tends to sit now and is very hard to access. So I, again, make this plea for this iterative process of using data, using the analysis, implementing projects, and then feeding back the outcome data into new projects. So with that, I think we'd like to, I'd like for the panel members to kind of consider those questions. And the question related to data is who's going to take on that responsibility in the global community at the global level. And of course, data is collected at every level, from the community, to the village, to the regional health center, to national governments. So that's the question that was underlying that comment. And then I think we'd like to go ahead and open up to questions from the members of the forum for the panel, or comments in terms of your thoughts on the way forward and how we can best move this agenda forward.
I'd like to throw out one other point. If there is any group of people that have a database and a nomenclature that is consistent and understood by all, it is those in the safety community. So if you wanted to parallel and or mimic a data system, it would be in the arena of safety. I just throw that out for thought.
Sorry. Well, first of all, I just want to thank the IOM again, because it has been a remarkable 2 days, and very gratifying to those of us who've worked on the informal economy for all these years, and to feel we have new comrades in arms in this major struggle. And I just wanted to throw out, well, first I wanted to say something on metrics. I endorse Mirai's idea that with the convening power, that maybe we should have a smaller, more technical convening around occupational health and safety, the experts, and really think through some of those issues. I think it would be great to have a similar workshop in each of the developing country regions with the same mix, cross-discipline, cross-sector, cross-country. And I would say the IOM, with all of its convening power, we've talked about needing to get 3 ministries on board, of health, labor, and finance, and somehow having some real serious top-level discussion on this issue. If there is this consensus, which I think there is, that the world of work has changed and informal employment is normal, and it's where the bulk of the workforce is. And I wanted to say something on metrics, but I have 2 sort of audacious proposals. With SEWA, or with SEWA very much in the lead, the WIGO network has convened 2 sets of what are called exposure dialogues with 2 different communities of practice. In an exposure dialogue, a select group of people spends 2 or 3 days and nights with a working poor person in the informal economy, living with them, working alongside them. And the dialogue part is that you take some theory, framework, system, model, assumption, whatever it is from your field of practice, and you talk about how the reality of what you've seen fits that. We did it for 7 years with a group of economists. We edited a volume called Bridging Perspectives, and it was economist theories about labor markets, labor interventions. We're doing it now with the human rights community because economic rights are not fully developed, and the human rights lawyers and judges are sympathetic, but they don't really understand what kind of legal reforms. But I think there's huge scope for one of the subgroups here of occupational health and safety, or the universal health practitioners, and do it at SEWA, maybe even with Raji Ben and Fatima Ben as hosts, could be hosts. So it's powerful, it is life-changing, and it would help all of us. So I throw that out. The other, not as profound but could be useful, is that the Ethical Trade Initiative in England, which has workers' groups, it has corporations, and it has government, sort of a different kind of tripartite, has a working group on home-based workers and in supply chains. And there may be scope for just having convening a dialogue on the supply chain issue with corporations that have been looking seriously within their supply chain. And this is where this first and second tier level suppliers using a lot of contract workers has come out. So I throw that out. On metrics, I'm very excited you're going to have a summit on metrics at USAID. So I hope we'll be invited. Can I be audacious? Because I think there's a need for those of us who work on labor force data to really seriously engage with Chris Murray and the burden of disease. We need to just take that challenge quite seriously. And there's another challenge, is that the health workforce, what share of the health workforce is informal, right? I venture it's a very large part, and we have the data, we probably could do the analysis. So there's a lot around metrics. And the other point on metrics is the WIGO network has committed to bringing together the producers and users of data. So I would say to the academics, we should involve some of the statisticians who design the surveys, and because we analyze the data, we have no idea the constraints they face in designing them. So and we do work with national statistical systems in many countries. So I would say that. And then just finally, 2 points. Again, from the point of view of people who've worked on the ground for all these years, every system, not just the health system, every system we're up against, every model doesn't fit this reality, right? So how we think about labor markets, employed, unemployed, that's how we think about it in the US. Self-employed isn't there at all. So then you add the self-employed. But we have a 6-segment model because there are different categories of self-employed. The labor economists don't want to hear that. Why? It complicates their modeling. They want to say, you do this intervention, you have this outcome. If you have a 6-segment model, they can't do their equations. We are up against, and they stigmatize the informal economy. It's informal, illegal. So we're up against every field has its assumptions and model problems, right? Labor law and employment law premised on a formal, recognizable employer-employee relationship. Commercial law, the right to declare bankruptcy, raise capital, whatever, assumes a certain size and formality of enterprise. We're now dealing, because we're focusing on cities, on urban planning. Doesn't have a plank in any of the training on urban livelihoods. Maybe a little informal settlements. So I now have an affiliation with the Graduate School of Design because we have to work with the urban planners, every discipline. So if we can have this group of people seriously working on health models, this would be great, because we're so engaged in other arenas that the whole paradigm has to be shifted. First, the stigmatization has to be lifted against. There is a wedge, there is a slice of informal entrepreneurs who are trying to avoid taxes, and there is a slice of people who are doing underground illegal goods and services. But the vast, the major pieces of the pie are people who are working poor. So I just want to say that from the bottom of my heart, that it's really nice to be in a community that didn't push back on our way of seeing the informal economy. We didn't get any pushback on, they're not paying their taxes and they're not doing this and that. Because it is where the bulk of the workforce is, and it's particularly where the bulk of the working poor, and particularly where working poor women are. And the other final thing is that the organizations of these workers need to be part of the equation. And so, like Barry had quoted the StreetNet quote, it's nothing for us without us. And so I just want to say I'm very gratified by the discussion over the last 2 days, and we hope we can partner in different ways.
Thank you, Martha, and thank you for all of your contributions to this workshop. It's been outstanding as part of the organizing committee and as a contributor. I think we'll take a question and comments from Simon Bland, and then we'll come back to the panel and have them respond.
Thanks, Kathy, and thanks to the panel and Clarion and all. Thanks very much for this couple of days. As we talked about yesterday, I mean, one of the great beauties of this is it's a fairly eclectic mix and a diverse mix of people that don't mix and mingle with one another on a daily basis. So, one gets to hear a lot of different perspectives, and with that, it can be a little messy and it can be a little difficult to see how we translate and take all this diversity into something that's practical and tangible for moving forward. I really haven't had the exposure to occupational health and safety, and so I've learned a lot about that sort of informal economy and informal sector, and there's a lot to think through and digest. I mean, the world of work is clearly changing. You talk about that, but it's changing for everybody. It's changing for you and I. It's changing at home for a multitude of reasons. I mean, one of those reasons is clearly connectivity. And you look at the advent of broadband and mobile telephony and social media. We now have more mobile phones than toilets on the planet. 6 billion mobile phones. There are 1.65 billion smartphones, on the planet. If you look at the world's population, China number 1, Facebook number 2, then India, then Tencent, then WhatsApp, then the USA, then Google Plus, then LinkedIn, then Twitter, then Indonesia. So thinking about nation states and governments and public-private partnerships, the paradigm is shifting, and how people communicate with one another and how people learn lessons from one another is really important. And the opportunities that provides for letting 1,000 flowers bloom, that bottom-up innovation and that low-cost innovation are huge. And I can't fully comprehend what that is now. But if you want to look, just look through, sort of health applications now, low-cost health applications, many of which fail, but some of which succeed. There's an awful lot of creativity out there. Now, I spend a lot of my time thinking about these sustainable development goals. And Kathy, I hear what you're saying around health systems. The world has come together and over the last 18 months has debated these 17 goals. So there's the first 17 goals here. We've gone from 8 in the Millennium Development Goals to 17 here. There's 169 targets. There'll be 2,000 indicators. It's a pretty long laundry list. And it doesn't include health system strengthening. So we could probably add, a few thousand more if we want to. And so I can be quite cynical about that. But I can also be quite positive about this, which is 193 member states coming together and debating a set of issues. And there's nothing in here that I would throw away. I suspect there's nothing in here that any of us would throw away. So they actually have come up with a list of things that we think are really important. The challenge is going to be, well, how does one translate that into prioritizing? How does one translate into implementation and resourcing much of this? For me, thinking about universal health coverage, and now I sit with UNAIDS, which is a single issue institution, right? And I think it was right to have an exceptional vertical program that dealt with this emergency. But as we move forward, I think that the pressures and incentives for doing that are diminishing. And so the need for sort of integrated service delivery, taking issues out of isolation is clearly there. But that's not easy, right? Because we have an institutional architecture. Someone said earlier we're sort of an institutional wiring that's a century old, and undoing that wiring is going to be really difficult. So figuring out how we get institutional change and reform is something I think we're going to have to work on really carefully. I mean, I think my final point is just I still want to consider how this forum, and Clarion, I take your point, not to have an over-reliance on the private sector. This is partnership. But there's lots of great ideas out there. Having Coca-Cola help us at the Global Fund think about supply chain management and saving the Tanzanian government $100 million in figuring how to supply medicines in a more cost-effective way. Things like that. It's not just about money. It is technical assistance. It is mentoring that's really important. And we should be looking for opportunities that I think do several things. They look at expanding the coverage. So we go into the cube. You can't finish off without talking about your cube. The cube on covering population, that last bit of the population is hard for a reason. Either it's geographically remote, it's politically isolated, it's not a convenient population for society because of policies and legislation, etc. And it's generally more costly to get to them. So that's why they're left behind. So if we can use leapfrogging legacy technologies to lower the costs and expand coverage, we ought to be looking at those sorts of partnerships. We ought to be looking at partnerships that reduce the cost of interventions, so better diagnostics, point-of-care diagnostics, market shaping for lower-cost therapies, because that then can expand. Well, it can do two things. It can expand the package of benefits we can give, and it can increase the overall coverage that you're going to give. So I think that's the challenge that I take back looking at this universal health coverage model, is how do we find innovations using both the public and private sector to drive costs down, to expand that coverage and expand that package of benefits. And there are thousands of innovations out there. I haven't figured out how we're going to sift through all that and figure that out, but it's I think it's really inspiring and exciting, and we've got some work ahead of us. And I hope that we don't finish with this meeting, and Clarion, that the forum can find ways of actually sort of holding our feet to the fire to say that we are making those connections, testing and failing, but learning lessons from those failures that really do close that coverage gap first of all, and then expand the package of benefits we give. Thanks.
Thank you, Simon. Those are very helpful remarks. I do want to give Ambassador Lang a couple minutes, and I want to give everyone on the panel like a minute because we have to finish at exactly 5:15. So I just want to make everyone aware of our time constraint now.
Thank you, Kathy. And just briefly, I wanted to reinforce what Simon just said. And it seems to me that there are various organizations around the table here, Rockefeller Foundation, WHO and PAHO, UNAIDS, and the UN Foundation, where I'm from, that are, and others, that are engaged in this post-2015 discussion and to how these goals will shape up and where this open working group that has the proposal for the Sustainable Development Goals is not the final say in this. There's still the Secretary General's report, and in the end, of course, it's the member states of the UN in the fall of 2015. But I think it's really incumbent upon us, those of us who are now much more aware of this issue of the informal workforce, to ensure that those discussions, especially as people start thinking in terms of implementation of the goals, really include from the very beginning the importance of the informal workforce, because it could really be a case, if it weren't there, that there would be a few people saying, well, but don't forget that those people in the informal workforce, but the bulk of this done through ministries in developing country governments could be focused on employer-employee relationships and not focusing on a much broader workforce. So I think we have a role to play in the discussions in New York in the next year.
It's great to have that advocacy. And I'm sure all the people who are involved in this day to day feel grateful for that as well. So I'd like to give the panel members a chance to respond to what they've heard. I think, can we start, Lorna, would you like to have any thoughts about the questions or comments that have been posed?
So just briefly, I mean, that, you know, and we looked at this example of Thailand, and I couldn't help but, you know, really both contemplate and congratulate Thailand for having really spent a lot of time developing an infrastructure that when you go to implement universal health care, there's an infrastructure that can absorb it. Because you can't, you know, extending coverage where there's absolutely no use, we've kind of talked about that, is not, you know, useful in itself. And to that end, one of the other components is sort of marrying the future, which is clearly, you know, these phones. It's, you know, it's actually ideal in many ways for the informal worker, because clearly they can't come to, you know, the hospital setting. So in general, this, you know, this also is parallel with the whole transition of how we deliver healthcare, how we do it cost effectively. And so, you know, it's kind of coming into the dialogue at a very good point, because, you know, we have to bring healthcare to where people are and make it efficient for them and make it cost effective. And, you know, the informal workforce is part of that dialogue, and this suits how they need healthcare in general.
I think I've said enough, but I endorse what colleagues have said here, and I think that occupational health and safety is a good way to bring in informal workers in general into the dialogue in the health sector.
Kathy, I'd like to respond just quickly about health systems strengthening and the universal health coverage movement. Ariel Pablo Mendez, one of the thought leaders who got us into universal health coverage as a part of our work, has looked at our USAID activities with other donor agencies helping countries work on health system strengthening, and said, look, there's lots of points of view about how to do reforms, as we used to call it, or health system strengthening. And many of those key areas that need to be given attention are really wrapped up in what we're now defining as universal, the drive for, or the initiative for helping countries reach universal health coverage. Most of the key agenda items are in UHC, and there isn't really sort of anything hanging out. There may be some more things added that would not have been a part of an agenda on health system strengthening. So I'm comfortable. I'm not in a position I'm not one of the negotiators. I can't speak for the American government, but I'm comfortable that a lot of the conversation about UHC is helping us move in the right direction. I wanted to say one other thing after a long time working on a lot of these issues in the metric side of things. We still know very little about what it takes to make a health system work better. the amazing accomplishments that we heard about that countries have tried to date that we heard about in this meeting all represent important experiments first that were then put in place. And I'd like to make a plug on the metric side, and will be as a part of the run-up for our summit, to those researchers who use qualitative methods to help us better understand what it is that's going on inside the black boxes. And so not only do we want to have a lot of numerical things work better to be able to line up these factors, but we need to look inside using the tools of the qualitative researchers as well.
Well, I would like to make a call that is a little bit broader, but workers' health as a whole has been invisible for many years, not only in the informal sector, workers' health in general. And this is something that we have to say out loud too. If you look at the countries, I can talk about the Americas as a whole. I would need to study more about the legislation in other regions. But when you look at the policies, all the countries have a labor code. All the countries have a minor, bigger or smaller regulation on occupational health and safety. All talk about the basics of occupational health and safety. But in the Americas, that's why I say in the Americas, most of them have some type of social security system or a workers' compensation system that is better known in the US. And when you go and see what is really happening, we're invisible. Furthermore, one of the things we reported in our progress report for our regional action plan is that we need people to understand that the productive system does not work without healthy workers. As simple as that, formal or informal. So, in fact, the call is we need to, yes, it's a bigger problem because it's a growing problem and the conditions are miserable, but as a whole, workers' health needs attention. Needs attention. Yes, big, what we call the big-size enterprises and medium-sized enterprises do have some, but small-size, micro, and own account, little enterprises, which are the 95% structure of the enterprise structure in the Americas, probably similar in the rest of the world, they don't have nothing. So this is why I say this is a big call, first of all. So in those lines, for those text forward, and I really would love, as I said, and I mentioned, I'm in the process of making a consultation to renew our action plan in workers' health for the region of the Americas. And we will probably be looking at something similar for the global action plan. So this is the time to sit down and think and work together. Of course, there's procedures we have to follow, like in all international organizations and private and public organizations. But I would really love to take some of all the packages I've heard here from outside of the Americas, from within the Americas, to sit down and work together for this. And finally, just one thing more. It would be lovely to push health services. I hope somebody has the time, the guts, and the courage.
So I have two quick comments. I appreciated his comment, the contribution. Actually, the formalization of informal economy is not proposed by the ILO, but from the constituents, especially the government and employers, because the contribution of the informal economy is not significant. And actually, without their contribution, the national development cannot achieve. So this is the very strong demand from our constituents. And regarding the health system, you have a very good analysis of the health system, the model, but we don't have any good safety and health system. At least we have the very good model from Brazil, from Thailand, and from Indonesia. So already we have the very good three models. Why don't we analyze and set up the good model?
Thank you, everyone. Clarion, would you like to make any final remarks?
I'd like to echo what you've said. Thank you, everyone. You've been incredibly selfless You've said what we needed to hear, which was with honesty, truth, and intensity. Thank you.